Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about allergies, something more than half of Americans suffer with in one or more forms. Our guest today is Dr. Punita Ponda, an allergist with Northwell Health, who has board certifications in Allergy and Immunology from American Board of Allergy and Immunology. Dr. Ponda, welcome to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you, Jeanine. Thank you for having me.
It's nice to have you today. So tell us about a little bit of your story, your journey, and what made you want to become involved in this type of medicine?
Absolutely. Thank you for asking. So I've wanted to become a doctor ever since I can remember. So that path was relatively straightforward in my mind for a long time. But as I got to know the different fields within medicine, allergy and immunology just always stuck out to me because there was a combination of people that you saw in the field of allergy and immunology. You can see children, you can see adults. You see patients who have allergies that you can help them through their issues and problems with. And then you have patients who have immune deficiencies that are involved in the other spectrum of the immune system. And the combination of all these different things led me to just fall in love with that field. And here I am.
Well, good. What is an allergy? Tell me how do you define it?
Absolutely. That's a great question to start with. Allergies are a hyper response by the immune system to something that should not have that high response. They started initially as a protective mechanism of the immune system, and a lot of these mechanisms were meant to fight off invaders such as parasites, but when those parasites and other invaders were there, the immune system, it's thought, might overreact to things that are just not invaders and not harmful, really. And that's how allergies are present and developed.
So when I think of an allergy, am I thinking of a disruption in my immune system, or is this something different?
That could be a way that you think about it, sure. It's a disruption that leads to an overreaction, and that overreaction causes its own problems. So I think that may be a good approach to just kind of put it in a nutshell.
Now, are they familial, meaning that do allergies run in families?
Absolutely. There is a genetic component to allergies. There's no one specific gene that kind of says that the person's going to have allergies, but like so many other things like diabetes and high blood pressure and other things, it's multifactorial. There's genetics, there's environment, there's person's predisposition that also leads them down that path.
So when I'm thinking about allergies, tell me what I can be allergic to. Is it just foods? You mentioned environmental. Give me some other ways I can be allergic.
Sure. So you mentioned food. We've talked about environmental allergies. There are people who have allergies that manifest on the skin, like contact dermatitis. There are allergies to medications. It's just an overreaction of the immune system that causes an IgE antibody. We have antibodies that are of many types, and IgG-AM are the other types of the immune system antibodies, and IgE is the antibody that, for lack of more scientific terms, is the allergy antibody. And if you can recognize something, usually a protein, and make an IgE antibody to it, you can be allergic to it.
So if I have a reaction or an allergy reaction to maybe a food, as I'm exposed to that allergen, is my reaction get worse with every exposure, or does it remain the same?
It can be varied. When we, for example, speak to patients who have had food allergic reactions in the past, we tell them that even though you had a mild reaction to peanut in the past, it is no prediction that a future reaction cannot be more severe. It is dependent on many other factors. For example, does the person have asthma? Is their asthma acting up that day? How much of the food did they eat? So how much exposure was there to their allergen? There's lots of factors that go into the severity of the reaction, and that can be determined also in part by the type of allergen, whether it's a food, whether it's an environmental allergen, whether it's a contact allergen. So lots of moving parts there.
So can an allergy be life-threatening?
Absolutely. For food allergies, it can definitely be life-threatening. And we do give EpiPens to patients who we diagnose as having food allergies. And for aero allergens, if a person has asthma, for example, and their environmental allergies lead them to have an asthma attack, that can also be quite severe. So absolutely, that is possible.
So I'm seeing more and more of a prevalence of peanut allergies. Can you tell me why that is?
That's the $1 million question, Jeanine. So there's lots of theories, and I can tell you some of those theories, but I don't know if anyone has a perfect answer. Some of the theories that are out there include the hygiene hypothesis, and I kind of touched on this before, that the immune system is thought to be battling infections. And when the infections aren't there, like parasites, it can have a hyper response to normal things like foods or environmental things like pollens. Then there's also the exposure aspect of things. Recent studies for food allergy specifically point out the fact that when children are not exposed to allergens such as peanuts early on in life, they are much more likely to develop the sensitization that can lead to the peanut allergy. So those are some theories that are prevailing in the allergy field as to why they might develop the allergies.
So how does one distinguish and make a distinction between having symptoms of an allergy versus a flu?
Sure. It's the package deal. So you can't go by one symptoms, two symptoms. You kind of have to look at the picture as a whole. And that's what we do with patients that present to us. Yes, runny nose and to a certain extent, itchy eyes can also be present in both the flu or a viral infection and in allergies. But for example, fever is not present with allergies. There are usually no sick contacts with allergies per se. Allergies will happen in a specific time of the year, often in people who've had allergies before. It's a combination of those factors. Allergies don't usually come with chills, muscle aches, which the flu can come with. And of course, the ultimate answer is to perform the testing needed to distinguish the two things. And when there's a high prevalence of infection, that's even much more important to rule out.
So how can I tell what I'm allergic to? I've heard of, going to get those, intradermal kind of needles under the skin to see what I'm sensitive to. Are there other ways that are not so invasive to say or to see whether I'm allergic?
Yes, and we get this often in our office where people are afraid that the testing will be very involved and painful. And I'm happy to say that you can determine what a person is allergic to in relatively non-invasive ways. The most common is something called prick skin testing, which is a process where a plastic applicator typically is applied to the skin, and it's applied through a liquid, the extract. And it doesn't break the skin, there's no blood, there's no needles. And that applicator leaves the liquid that it scratches the skin with on the surface of the skin. You wait 15 to 20 minutes, you wipe off the liquid, you measure the test on the arm usually, and the size of the test tells us the level of IgE antibody to that allergen that we just tested. With that, we could tell you what you're allergic to. And most people, the most that they will feel is they will feel some itchiness at the site of the extract that was placed if they're allergic to that item.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about allergies, something more than half of Americans suffer from in one form or another. With us today, our Dr. Punita Ponda, an allergist with Northwell Health who has board certifications in Allergy and Immunology from American Board of Allergy and Immunology. So I have another question for you, Dr. Ponda. You talked about sort of like the scratch test to find out, whether you are allergic or not. Once I do know what I'm allergic to, does that mean I cannot have this anymore?
So if you're talking about a food,
yes.
Okay, great. So that's a loaded question, Jeanine. So I'm going to kind of unpack it a little bit. So the first and foremost thing to say is that just because a skin test shows something that's positive, it does not always mean that you have that allergy to that food. Just like the distinguishing process between the flu and allergies, we take the package as a whole, and what goes into it is, in a large part, the history, and that's paramount. So there are times when I could have milk and milk products, for example, but when I do a skin test, my milk skin test might turn out positive, so i.e. a false positive. And if you start with someone who has very low likelihood of having a food allergy to that food, and you test them, they're much more likely to get a false positive than you are with someone who just had a reaction to milk, and then you test them to milk and it's positive, then you're much more certain. So just putting some numbers out there, when you do food testing without a good reason to test for that food, your likelihood of being accurate, so the false positive rate, is up to 50%. That's like throwing up a coin. However, if you do it when you have a history of a reaction to that food and you test that food, the accuracy is much better, upwards of 90%. So it depends on the test and the reason that you're doing the test and how accurate the result is going to be.
So when we suspected allergy because of this dermal reaction to the allergen itself, the next time the patient comes in, do you do more of a venous kind of sample to find out if they're allergic or how severely they are allergic to that allergen?
Yes, we do blood testing as well for the IgE antibody. For foods, the accuracy is very similar. But on the other hand, for environmental allergies, for example, pollens or pets, those numbers that I just quoted are very different. Even for people who haven't shown great symptoms yet or significant symptoms yet, the accuracy of the environmental allergy tests is, 90-95%. So both on the blood and the skin for environmental and food allergies, both ways, skin testing and blood testing, have their pluses and minuses.
So how do you inform your patients in handling the allergies? What do you tell them to do?
So for environmental allergies, we have avoidance measures that we talk about. For example, springtime, when pollen is in the air and the person is pollen allergic to the spring pollens. And by the way, the pollen counts these days in our area are moderate to high, and certain tree pollens like maple and juniper are prevalent right now. So if the person is allergic to those, some of the things that we suggest are, if you're going to be outdoors all day, when you come home, jump into the shower, wash the pollen off before you go to sleep. If you can avoid outdoor activities early morning, 6 a.m., 7 a.m. run, maybe do the run at 5 p.m. That would be better on high pollen count days. If you know you have allergies, to start your medications before the pollen counts come to the moderate level would be a great idea. So those are some things that we talk about for environmental allergy prevention and avoidance once we know what the person is allergic to.
Where can I get that information about pollen count?
Great question, too. So there's lots of sources. One good one that I like, and I have no relationship with this company, is pollen.com. And you can put in your zip code, and it pops up with pollen counts. And you can have today's, you can have a few days from now. It's really a good site. And I tell my patients about it.
How does that translate into like tree allergies or, if you have grass allergy or other kind of environmental sensitivities?
So that site does tell you what the prevalent allergens are, including what trees are prevalent, what grasses might be prevalent, and grasses would be in the summer and weeds would be in the fall. So they do follow that and they do it regionally.
Talk to me about medication protocol for patients experiencing allergies, from over the counter to what they would come in your office and you would prescribe or herbals, if you will.
So the typical treatment that we use for environmental allergies is a combination of a nose spray and an allergy medicine by mouth. Most of these things are now available over the counter, and the nose spray is thought to be the most effective because most of the issues that arise from environmental allergies are from a person who is allergic who breathes in their trigger allergen. For example, the tree pollens. They're outside, breathe it in. The nose is present with the IgE antibody. There's an allergic process that causes them to have the production of fluid that causes them to be congested or have a postnasal drip. So both of those or all of those symptoms can be targeted by a nose spray. So that's the first thing that I start. And then
what is the name of that medication? Not to interrupt you. Give me the name of that.
Oh, sure. So there's many out there. Fluticasone is a common one. Nasacort, mometasone is another one. They're available over the counter in most pharmacies. So it should not be difficult to get those medicines. And then we add on antihistamine by mouth, like Allegra or Zyrtec or Claritin.
Any herbs?
I am a believer in natural remedies as long as we know enough to know that they're not harmful. And no specific herbs that I would say are scientifically validated, but there's plenty of natural ingredients that are very helpful for a lot of people. So I would just do your homework and make sure that what you're taking is safe, and then go for it.
A lot of people have allergies to pets. What exactly am I allergic to when I have a pet?
So when a pet allergy is diagnosed, there are certain things that we look for. For some pets, it's the dander, the hair of the animal. For some extracts, it's the pelt, meaning the skin. There's also saliva and urine that someone can be allergic to from that pet. So it's very specific, and you could be allergic to multiple of those sources of pet antigen as well.
A part of your certification, I know, immunology, and we're, we're in a global pandemic. Talk to me about allergies and the global pandemic. Tell me how that has the connection there with patients that you see.
Sure. So in light of the pandemic, there's two aspects. The care of allergic patients and patients with immunological diseases. So looking at the care of patients with allergic disorders. On the one hand, for patients who have environmental allergies, when we were wearing masks, a lot of them felt better. When you went outside, you didn't have as much of the pollen that ended up in your nose and eyes and mouth as you did before. And we were indoors often. So that way it helped their symptoms. And now that the pandemic is abating a bit, we see more of those symptoms coming back. And the other aspect of allergic diseases is that patients who were getting allergy shots, for example, had a difficult time coming in during the pandemic because of the lockdown and so on. And now those patients are back and getting their treatments more regularly and starting to feel better. For patients with immunological disorders, this has been very, very difficult. A person who was already at higher risk for getting infectious diseases now is put in a situation in a pandemic where infectious diseases like coronavirus are in such high prevalence. They really were in danger and had to take strong measures to protect themselves, quarantining, vaccines, preventative treatments, and so on. So we saw the gamut of those issues as well. And we're just happy that we hope to come out of this pandemic in a better way.
So did you see in your practice any patients who were, quote unquote, allergic to the COVID immunizations?
We run a full COVID vaccine clinic, and we look at patients who've had reactions to COVID vaccines. And we are the site for Long Island and large part of New York. And we did see reactions. We teased through things. We helped people and continue to help people get their vaccinations as safely as they can.
So in order for a person who was allergic to a vaccination, is there anything that you give with the vaccination so that there is not a reaction?
Yes. And again, this is a package deal. It has to be, every person is different. Every story is different. And what is done for each person in terms of management of their issue is different. So I am going to generalize. So that's my little disclaimer there first. But yes, there are situations where we have had success with pre-medication, giving antihistamines, for example, before the vaccination to prevent problems from occurring. Sometimes we start a couple of days before and continue through after the vaccination. We optimize the person's other medical conditions, such as asthma and other things like cardiac disease or other issues that they might have before planning for this. So absolutely, Jeanine, there's ways to mitigate the risk of vaccination, and we have helped many people manage that.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about allergies, something more than half of Americans suffer with in one form or another. Our guest today is Dr. Punita Ponda, an allergist with Northwell Health who has board certifications in Allergy and Immunology from the American Board of Allergy and Immunology. So another question for you, Dr. Ponda. I know for myself, every time I eat a piece of fruit, for example, I get this itchy mouth. My palate is very itchy from certain fruits. And I always look at, okay, where's the fruit being imported from? What are some of the things that I need to be, that is it organic that I need to be purchasing? How can I avoid this itchy feeling?
Excellent question. I can't tell you how often I hear that complaint and how often people are just kind of suffering through this process and not eating fruits and vegetables that are, one, healthy for you, and two, often these are people that love these fruits and vegetables, so they're avoiding things that they enjoy. The most common reason that we find for that type of reaction to fresh fruits and vegetables is something called oral allergy syndrome, which actually is a cross reaction between the pollens that the person is sensitized to and the fresh fruits and vegetables. And what happens is the immune system misrecognizes the fruit protein to be similar to the pollen protein that it is allergic to. And when the person eats a bite of that apple, the body thinks that it is contacting pollens and therefore creates an allergic process where the pollen or their perceived pollen, the fruit, touch the person's tongue or mouth. And once that food is eaten and digested, goes into the stomach, that whole process goes away. That's called oral allergy syndrome. And the way we manage it is we treat the allergies. Once the allergies are adequately treated, those symptoms tend to improve. And in the meantime, cooked fruits and vegetables don't have that problem because the protein that is misrecognized gets denatured with cooking. Mm-hmm. So it doesn't look the same to the body, and therefore there's no reaction to it.
Very interesting. What about allergies to the preservatives? Because there's a lot of, number 9 dyes that are put in certain foods. What about, do you see a lot of allergies with preservatives that may be in prepackaged foods?
There's a lot of people who do feel that they might have issues with preservatives. However, when you look at the scientific basis of it and how many people actually can be proven to have that, it's relatively rare. A lot of the reactions can be clarified by a thorough history of what the person is reacting to. And I think to avoid extra preservative-containing foods is a no-brainer. You should do that. It's healthier to have natural, less preservative-containing foods anyway. So there's no harm in trying to avoid the preservatives. However, a true allergy to preservatives is quite rare. And we typically can go down through the history and figure out what's going on with symptoms that the person has noticed. And then once in a while, we settle in on the preservatives, but most of the times we can find other reasons for the problems.
I'm going to ask you a quick question. How can I boost my immunity?
There's no quick, easy, dirty way to do this. I wish there was. So the recommendations that I would have are 1, a healthy diet, 2, exercise, good sleep, just the basic stuff.
Thank you for being here, Dr. Punita Ponda, an allergist with Northwell Health who has board certifications in Allergy and Immunology from the American Board of Allergy and Immunology. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you so much for having me. It was a pleasure.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.